Warts due to HPV are extremely common in children and adults as well, but in children it's a much more common problem because children tend to play together, huddle together, physically interact with each other a whole lot more than adults on average, and children don't have the immune memory or the immune knowledge of warts in the first place. Many of them have not been exposed to the human papillomavirus, which causes warts in most cases. So children are much more prone to getting warts, and it's a much more common problem in children. And because warts are an infectious disease, that takes a special priority to treat in children. Sort of. Well, why sort of? Well, warts are not a very serious condition to have. In most cases, they are a self-limiting condition. They go away in kids within about 6 months to 2 years from the time they appear, so the body does eventually take care of them in the vast majority of cases. They also are not a life-threatening condition, meaning they don't really lead to much of a problem except for the aesthetic issue. And in some cases, especially when they appear on the foot or on the hands, they can create tenderness over the areas that they affect, and that can be a problem for the child to be active, to play. And that definitely merits treatment on its own, regardless of the aesthetic issues that warts may cause. So warts do go away on their own, but they take some time to go away on their own, and they may cause aesthetic issues. It may cause tenderness and impediment to physical activity. So we do want to treat the warts, especially if your kid is active. You want to get going and treat that. Well, how do you do it? So first, there are the home remedies, and those can be extremely effective, especially when you're dealing with small numbers of warts and warts that are kind of wimpy, not too thick, not too crusty, usually not affecting the hands and the feet, although some of those may actually respond to some of the home treatments that are available. The first home treatment that I wanted to discuss was duct tape. Duct tape is an ancient technique. It's been used for many decades by many a parent. And the way you use duct tape is apply the duct tape to warts where they are, leave it on for a few days, let it go and forget it, and then remove it, usually after 6 days or so. And that can actually lead to irritation and involution of the warts, meaning the warts disappear on their own, probably taken out by the body. And that's a very low drama type of treatment that may have some pretty good return on investment for you, may get rid of the warts altogether. Then there are the over-the-counter cryotherapy devices like Dr. Scholl's Freeze Away or Compound W Freeze Off. Those two use dimethyl ether or DME along with propane or butane to create a cryo mix which can cool down the warts and create damage through cooling the skin down. Cooling down of the wart may lead to destruction of the lesion. It may take a few sessions or a few attempts. And mind you that the over-the-counter cryotherapy solutions are not as effective as the ones we have in clinic. They just don't get as cold as some warts require, especially the very thick warts on thicker areas of the body, such as the hands and the feet, for example. So that could turn into a fool's errand. So know your limitations. After a few attempts, if the warts have not budged at all, you may as well seek the advice of a board-certified dermatologist and see what can be done in the office. Salicylic acid in various compilations may lead to maceration and softening of the wart that allows easier peeling or scraping of the wart. They're not exceptionally effective in getting rid of warts, but they do make the warts easier to scrape off, so you can actually treat the lesion underlying all the thickened skin on the wart, and in some cases that can lead to irritation of the wart itself that induces the immune system response and take it out of the wart from within. So that could serve as an adjunct treatment to other treatments of warts, and it's not a bad idea to try this out on the wimpier warts that you have and see what happens. Applying an over-the-counter irritant, if you will, such as a adapalene gel that is usually used to treat conditions like acne, for example, to the warts twice a day, especially where we're talking about small areas that are affected, not too large an area. Applying that twice a day to the areas that are affected can lead to irritation of the area, and the irritation, again, gets the attention of the immune system to the warts and allows the body to start channeling the immune system to target the warts and get rid of them. Now, mind you that this can lead to severe irritation over the area. So you have to balance out the irritation and the response that you're looking for. So if you've gotten a lot of irritation and not too much traction, you're probably headed in the wrong direction. But if you've tried it over a small area, got a little bit of irritation, meaning redness and itchiness and flakiness, and the kid may be a little uncomfortable, that's fine, but as long as the irritation is not too severe and the warts appear to be getting crusty and irritated, and eventually they need to go, they need to disappear. So that has to be factored in when you use something like adapalene gel on warts. Now, when you bring your kid to the dermatologist's office, there are a variety of options that the dermatologist may use to treat the warts on your kid. I do separate children into the warriors, those that are troopers that are going to go with the most effective, though maybe very uncomfortable treatments like liquid nitrogen, which is extremely effective, but actually feels like frostbites over the treatment areas. And then there are the more soft-hearted kids that may not put up with much, and those kids can use treatments that may be less effective, but are not going to be as uncomfortable as the liquid nitrogen. So liquid nitrogen sprayed on warts is a completely legitimate technique to use in kids, especially if the kid plays ball and is ready to play along with this. And there are many such kids that are just great. The parents bring them in, great parents, bring the child in, talk to the child, tell them what's going on. You're going to freeze the wart, you're going to hit it with some liquid nitrogen. It's going to be very cold, might be uncomfortable, and the child knows to tell you when to stop in case it gets too much, too uncomfortable for the child to bear. And that is completely legitimate. It can be done very gently, very patiently. And that's the most effective technique to treat, especially when we're dealing with very hard, thick warts on areas like the hands and the feet, and maybe some other areas of the body. But those warts are going to be very difficult to turn around with other techniques. So you may want to hit them hard and aggressively and have the child play along with you and allow you to work the magic of liquid nitrogen. Then another technique that works for warrior kids is Candida antigen or other antigen injection into warts. Now that technique involves an injection into a wart or a couple of warts of antigens that induce an immune reaction to the warts by the body. And that may take a few sessions to get going. It actually gets some traction from the immune system. So obviously the kid has to understand that this is going to take a couple of injections. Injections are very quick. They're painful, obviously, because you get stuck with a needle. But at the same time, they're quick and they're easy to do in the office. And they actually induce a very high rate of response. Those techniques are very valuable, especially when you're dealing with large numbers of warts, where you don't want to treat the entire cadre of warts with liquid nitrogen and cause a lot of pain and suffering for the kid, or by the way, in an adult as well. So that technique can work very well when you're dealing with large numbers of warts in a kid that is ready to play ball and actually take the warts on, get rid of them. That's an excellent technique. Now for the mid-level warriors, or for kids with a lot of warts that don't want to be injected and obviously are not going to get frozen with liquid nitrogen, one can use cantharidine, which is a blistering agent, otherwise known as beetle juice. This is traditionally derived from a beetle that uses the compound as a weapon, as a defense mechanism to blister the skin of its attacker. And this agent can be painted on the warts like a lacquer, be dried up on the warts, left to set, and after a few hours, the area may blister, causing the sloughing off of the skin off the warts, often with the wart on top of the blister roof, and may lead to effective resolution for the warts. There's going to be some blistering. The blistering may be uncomfortable, but the painting of the compound is completely painless. There's no problem with applying it on the skin. Mind you that if you are using cantharidine on the skin of a child, it needs to be occluded with a Band-Aid or a piece of tape to make sure the compound doesn't go everywhere. It doesn't hit other areas of the body where it can cause blistering just the same. It's one of those superpowers that the child doesn't want and you don't want your child to have. And that's why we tell the parents to wash off the compound at bedtime at the latest if no blistering has occurred, so the child doesn't have the compound on their skin and continues to move around in bed, spreading the compound and potentially causing widespread blistering. That's a big no-no right there. For the gentler kids, and there are such kids that are just not up to getting treated with liquid nitrogen or cantharidine or the injections, mind you, those kids may benefit from treatments that are a little bit milder and may take a longer period of time to induce results, but do get results in a lot of cases. And those are the topical treatments. So topical treatments like using medications like imiquimod, for example, which can be applied to the warts consistently once a day for a few weeks. And there are various protocols to that. You need to obviously talk to your dermatologist and see what's the most effective schedule to apply the medication. Then there are medications like tretinoin, which is a cousin of adapalene that I mentioned earlier, which is a stronger medication which could be more effective in inducing that irritation that we talked about earlier. And then there are other medications like 5-fluorouracil, which comes in a cream form as well, that can be applied to warts to induce irritation and eventually lead to involution of the warts. So the topical treatments are a great solution for the kids who have either widespread warts or a few warts but are not up to getting those very aggressive and potentially uncomfortable treatments. And they can work, and they may take a little bit more time, and obviously you're doing all the work at home, but that's okay for a lot of parents and a lot of children. Now, for very widespread cases where you have a lot of warts on a child and nothing has really worked, cimetidine, which is an H2 or histamine receptor blocker that is usually used to treat heartburn, for example, that medication can be given in high doses to the child orally. And that medication is thought to be working through induction of immune response of the T cell system to target the warts and take them out by means of an immune reaction. So there you have it, multiple treatments for warts. It's a very common condition that affects numerous children. Probably the majority of children are exposed to the virus. A lot of them develop warts and can be contagious or infectious, or experience an aesthetic issue or discomfort due to the warts on the hands or on the feet. This needs to be treated. We have the home remedies, we have the office remedies, we have a whole slew of remedies that can be used as alternatives, and you just need to pick and choose. See your board-certified dermatologist if you run out of options at home. Dermatologists are going to be very effective in addressing your child's warts and getting you to safe shores. If you've enjoyed this video, don't forget to smash that subscribe button. Also, don't forget to share and like this video. For more information about great opportunities for cost-effective skincare, pick up my book, Sick Skin, Skincare Made Simple on Amazon.com, now available in audio. Thanks for watching. God bless.